Welcome, my name is Dr. Hadria from Harley Street Dermal, and today we're doing a talk through the assessment and treatment for the non-surgical facelift with a particular emphasis on the under eye restoration here. So we're starting off with this lovely lady's before image, and you can see there's, bless her heart, she's got quite a bit of indentation in this area, a little bit of swelling and puffiness in the under eye area as well, which is causing some pigmentation, and there is a little bit of edema in the under eye bag, which is actually causing a bit of puffiness, which makes it look slightly baggy but also slightly indented. And there's a bit of volume loss in the cheek as well. Here you can see there's a little bit of indentation here. Some volume loss in the smile lines. You've got mouth corners indented here and a little bit of volume loss underneath the mouth, which is quite common with the passage of time. You can see the chin's actually got quite good length, but the early onset of jowls here is creating an indentation in what we call the pre-jowl sulcus, which gives it that kind of like indented look. So often a combination of all of these treatments together can actually help to lift the face, but with a particular emphasis on the under eye, we're going to have to use a few approaches. So diagonal approach this way, a horizontal approach this way, and a diagonal approach this way, just to blend out the eye from all three angles. We can actually double up the support under the eye, because often we use a slightly thicker filler to do the lowest part of the eye, which is sometimes quite deep to lift out with the normal teardrop filler. We can double that up with the actual cheek filler that we're doing to just kind of blend them into one piece. So that often we can double up the treatments to get kind of maximal effect and without using too much filler where possible. So the overall effect will be this. So you can see the under eye has been blended out beautifully. There's a little bit of inflammation because this was taken straight after the second stage of treatment. So this was actually done twice to achieve. It's often very important to consider that sometimes some of the deeper under eyes or the more prominent eye bags do need more than one session to treat. Most people only need one session, but a small number of people do need a bit more. But you can see there's a little bit of redness and inflammation because this was taken right after the treatment. The cheeks have been lifted beautifully and blended into the under eye completely. So you can see there's that kind of baggy, hollow, pigmented look is much softer. The smile lines have been softened. The jawline has been tidied up. We've just blended the chin into the jawline, and the volume loss underneath the mouth has been lifted out completely to neutralize the corners instead of sagging down. Overall, this person's got a well-deserved, refreshed appearance now. Just a nice bit of a lift, looking as natural as possible without making it obvious that any work's been done. So that's the non-surgical facelift using dermal fillers in a nutshell. And thank you so much for watching, and let me know your comments below.